Hello. A lot of the videos that I watched either had to do with bias in a healthcare setting or with the healthcare setting for people with involved disabilities. So I would definitely say that the videos on involved disabilities was pretty emotionally challenging. It was just sad to hear some of the examples of these people, especially one mentioned a case study. It was redesigning primary care, the video on re-envisioning care for people with involved disabilities. And they talked about Anna, who was a 65-year-old woman with Medicare and Medicaid, and she had progressive multiple sclerosis. She had a suicide attempt. She had COPD. They found her. She was on like a 20-year-old mattress with ulcers. And it's just really sad to think that there's people like that out there who can't make it to the doctor, that just have to sit and suffer, and no one knows that they're going through the suffering because they can't make it to a doctor, or doctors never visited their home. So yeah, they might know when they show up to a clinic they're in clean clothes, but at home, they don't really have access to that kind of stuff, and they're having a hard time at home. So not going home really impacts, how the doctor views this person. So that was, it was kind of shocking to hear that. And so again, with that, a lot of those videos for re-envisioning care for people with involved disabilities, they kind of raised some concerns, especially, the one that was creating culture change, raised some concerns with trust with doctors. The doctor approach is very, we know best. We're your doctor. You're supposed to listen to us. And, the patients are going to be compliant and listen. But these videos really talked about a need for listening to patients and asking what they want, and, saying that the people should have a choice and a voice in their healthcare. And so I really did like that. And then another one of the videos that was on bias, it is what is bias and what can medical professionals do to address it. That video actually kind of raised a concern for myself, because it talked about biases, and you can have unconscious or implicit biases that you really don't even know you have. And, so everyone wants to think, I'm not biased. I want to treat everyone the same. Everyone is equal. But there are things that you do that you don't even know you're doing that can be biased. So that kind of like raised some concerns for myself, like, well, what are my biases? One of them actually mentioned a quiz that you could go take to find your implicit biases. So I am going to take that to see, find out what my own are, because I think that's a really useful tool that medical professionals should be utilizing. So this video and none of these videos really conflicted with any of the beliefs that I have, because really I just learned from them. I really learned about biases, and I learned about people with involved disabilities and the healthcare inequities and stuff like that. So nothing really conflicted with any beliefs I had. It more opened my eyes to things that, I might be doing in my daily life. So these videos, I would say the only main question that they left me with was, what are my own biases? I would really like to know, what do I do daily or when interacting with people in class or whatever, if I do anything that seems implicit biased. I don't think I have any conscious or explicit biases, that they talked about, like racism or homophobia or anything like that. But there could be things that I'm doing unconsciously that, are offending people or making me treat people differently. And that's not something that I want to have in my life. So I guess my biggest question would be like, what are my implicit biases? And then how do I go to change those implicit biases? And so the issues kind of meshed with my past experiences. One of the videos, it was the what is bias and what can medical professionals do to address it. It really reminded me of the cultural competence class we had to take. That class really focused on, the inequities between, the different types of people. And we actually learned about conscious and unconscious, or explicit and implicit bias. And so kind of hearing that actually applied to the medical field was something that I think was really eye-opening to me, that, that wasn't just a class I took in college, that actually applies to the medical field, and it's really out there, and people really do learn about this and teach about it and talk about it. Um, Another thing that kind of stuck with me is, you know, the videos that were about re-envisioning care for people with involved disabilities. I actually have a friend who has multiple sclerosis, and she's more on the beginning side of her diagnosis, but she's definitely starting to have a little more issues, you know, ambulatory issues and issues with some of her ADLs. And so really like looking at these, and especially when they did talk about Anna and, you know, that case study they did with her, it really kind of opened my eyes to like, I could have a friend that goes through this, you know, that can't make it into the doctor, that has issues with, you know, living at home. And, you know, if she goes into the doctor might think she's fine, but her house is a mess. She can't clean, she can't cook. Maybe she doesn't have a support system. So, you know, that just kind of made me think about her in a different way. It made me think, you know, like, well, if that were me, I would want someone coming to my house and really helping me, and not someone like a nurse, someone like my physician coming to my house and, you know, seeing how I live and what affects me. And I think they actually kind of mentioned that in the benefits and challenges of home-based primary care. The woman said that her physician, until she visited her house, she didn't know that she had a daughter. She thought the girl she brought in was like she babysat, you know? So this woman was wheelchair bound, in and out of hospitals, all of these issues, and she had a daughter, and the physician didn't know that. So when looking at the patient, the physician didn't think, this woman has a daughter, so how am I going to, you know, address things that might have to do with her daughter? And I know that's kind of a little more on the OT side of things, but it was really interesting to hear that and to kind of like put the pieces of the puzzle together that, you know, like there is an issue out there with people with involved disabilities, and there are issues with bias. And for the bias, you know, I want to say that it's not people's fault for the implicit, or is it implicit? Yeah, the implicit bias, because it says it's ingrained. They're unconscious. I don't think anyone would choose to act that way if they knew they were doing it. So I think the main issue is bringing those issues to light, taking the quiz like the videos mentioned, and, you know, having people figure out what their biases are, and then working on trying to address those in a professional setting. And so that was probably my biggest takeaway from the videos, is just, you know, it's important to know these kind of things to be an effective healthcare worker.